Hello, benevolent beings. Thank you for tuning in for another part of my two-part video series about period pain. If you missed the first video, it's the one where I talk about reflexology points that you can use on yourself if you're experiencing period pain right now. In this video, it's my intention to explain more about why some people experience period pain and others don't, and what you can do to support your body in finding health and balance. We're going to talk about the reproductive system and the endocrine system and ways that you can support your own body in healing so that you don't have period pain anymore. It's been ingrained in us in Western world that period pain is just normal, it's just a part of life, and it's very disruptive. It affects school and work, and people miss out on all kinds of events in life and things like that because of their monthly period pain, or they go on birth control or take pain meds just because of pain, even though they don't maybe need the birth control or want the birth control. So we're going to take a holistic approach in this video and talk about, number one, why, because that is the holistic approach. What is the root of this issue? What is going on in there that's out of balance, that's unhealthy? And two, how do we help our body heal itself? So one of the first topics I'm going to cover in this video is the position of your uterus. You may or may not have this awareness that your uterus can be malpositioned. It's actually known as the wandering organ. So the uterus is different than, let's say, your liver, because your liver is really fixed in place. It doesn't like slip out of place. But your uterus gets bigger and smaller again every single month. So at the time of menstruation, your uterus is at its biggest, and at the time of ovulation, it's smaller. And if you check the position of your cervix vaginally, you'll actually notice that it gets further away around ovulation because it's smaller, and around menstruation it fills with endometrium, and for some people it gets even bigger, and I'm going to talk about that as well. And it also gets really big when it has a baby in it, and then it gets really small again after birth. And because of that mobility, it's actually an organ that is susceptible to getting out of position. And you may or may not have been told that your uterus is out of position. It's really, really common. I know that my uterus is tipped back, so I have a retroverted uterus, and I've seen this on ultrasound reports, but doctors often don't even tell us because it's so common, it's just considered normal. But I'm going to explain to you why it matters, and how you can know what position your uterus is in. So when the uterus gets big around menstruation, if it's tipped back, that's going to affect the digestive system. People tend more towards constipation because you have the pressure of this uterus increasing on the bowels, on the large intestine. And when you have a uterus that's tipped forward, if it's anteverted, it'll be resting more on the bladder. And so a larger uterus that is putting pressure on the bladder is going to increase the frequency of your urination. And you'll just pee a little bit, right? So you'll pee a little more frequently because the bladder just doesn't have as much room as it does around ovulation. People who have a uterus that's tipped back, they can hold their pee forever. There's lots of room for the bladder because the uterus is completely out of the way. So that's one way that you can kind of identify if your uterus is tipped forward or tipped back. The other thing that you might know is, like, where do you feel your menstrual pain? Because if your uterus is tipped more back, you might feel it more in the back than if it were tipped forward. And but some people even feel menstrual pain like in their legs, and this is pain that's sort of radiating through the nervous system into other areas of the body. So there are other reasons why this is important. When the uterus is tipped, it can even be like retroflexed, where the cervix tips back and the top of the uterus tips back, so it's kind of C-shaped. And when the uterus is not like upright, if it's kind of bent to the back or to the side, it's harder for that endometrial lining to slough off and come down and out of the body, and so some of it is retained. And when you have old blood in your uterus at menstruation, you'll see that because it'll come out as brown blood, usually at the beginning of your flow or at the end of your flow. Some people have brown spotting, so that's older blood. When blood is really old, it actually turns black and is more like coffee grinds. That's not as common, but if you've had menstruation like that, that's really old blood that's coming out. And so you can imagine that like older blood that's been sitting in there, it gets thicker and harder to slough off. And that's another reason why you'll have period pain, because the uterus has to contract more and work harder to get this old blood or old tissue to slough off than if it were in good position. The position of your uterus also affects the circulation to and from your uterus, right? So that's the delivery of oxygen and nutrients and the elimination of waste from this organ, its tissues and cells. It also affects the nervous system. So we want a uterus that's positioned really well so that our nervous system can communicate really effectively with the uterus, and that circulation flow is really healthy, because we don't want old stagnant blood building up there as well. So if you don't know the position of your uterus, or if this is an issue for you, you can talk to a holistic reproductive practitioner or massage therapists who are trained in our Vigo massage or abdominal massage, perhaps even an osteopath, to help you assess the position of your uterus, teach you some self-care. Holistic reproductive practitioners are really good at teaching you how to do abdominal massage, for example, on a malpositioned uterus, to help with that elimination of waste and assimilation of nutrients and healthy blood, and to help it to kind of reposition itself. And it's something you can do on a regular basis. I could talk more about that, but I want to move on and talk about a really important mineral for reproductive health, your uterus, and pain specifically, and that is magnesium. So the uterus is not just any organ, it's actually a muscular organ. It's made of muscle, and it's those contractions of that muscle that are causing the pain that you're feeling. The contracting is normal, the pain is common, not normal. So I'll give you another example. First, I want to say that like most people are deficient in magnesium. So almost everybody can supplement with magnesium, and you're only going to benefit. If you were a runner and you're deficient in magnesium, you're going to get muscle cramps in your legs, right? It's because those muscles need that magnesium. So those cramping in your muscles is a symptom of a deficiency in magnesium. So same thing with your uterus. So you can eat more magnesium-rich foods, but you probably won't get as much magnesium as you need in the modern diet. So supplementing with, I like an ionic magnesium, and I like the liquid form. It often comes, I like the raspberry ones because it tastes good, and that means you're not going to forget to take it because it's like a little treat. I like the raspberry flavored magnesium supplement. So you can take that every day safely, because if you get too much, your body's really good at eliminating it. You're going to get loose stools. And so if you start to get loose stools, you can decrease your dose a little bit. If you suffer from constipation, then you're really going to enjoy supplementing with magnesium, because it's going to help with that as well. There are other ways besides food and an oral magnesium supplement that you can increase the saturation of your cells in your body with magnesium, and that is getting it through your skin. So remember in video 1, I was talking about doing the reflexology techniques that I was showing you in a warm Epsom salt bath. Epsom salts are an amazing source of magnesium. So put a full cup of Epsom salt in your bath, soak in there for at least 20 minutes, and that's going to help increase the levels of magnesium in your body. If you want to take that to another level, go to a float tank. If you've got float tanks in your community, there's so many benefits to this, but what we're talking about today is the magnesium. They put 1,000 pounds of Epsom salts in that float tank just for you. So when you're laying there and floating for an hour, you're getting like maximum dermal saturation. So through your skin, it's so relaxing. Other ways you'll know you're benefiting from this extra magnesium coming in orally and through your skin is you will sleep better, you'll be calmer, less anxiety, if any anxiety. Misophonia is a type of anxiety that some people have that maybe they don't even know it's anxiety anxiety. Misophonia is a sensitivity to sound. So if people chewing or like clicking their pen really grinds you and creates this like irritability and even feelings of rage, you're probably magnesium deficient. And by upping your magnesium intake and saturation in your body, those symptoms are also going to decrease in addition to pain. I also recommend these ways of increasing magnesium later in pregnancy as well, or throughout pregnancy, but especially later in pregnancy, because it's going to help you to be more comfortable when you give birth, because your muscle, the uterus, is going to have one of the minerals that it needs to be really efficient and less uncomfortable. Okay, so let's talk about some imbalances that might be happening in your body. You may or may not have a diagnosis. I'm actually not that concerned with getting a diagnosis. If you have these conditions and don't know it, the approach that I'm going to suggest is going to help your body to heal anyway. So I'm talking about conditions of the uterus, and we're going to talk about hormonal imbalances. So there are lots of conditions that can be going on inside your body that affect the uterus specifically. Some of those are fibroids, which are benign tumors in the uterus. You can have one or more. They can be pedunculated, like hanging off the uterus on a stalk, or they can be intramuscular or on the uterine wall itself. So in the wall, on the wall, hanging off the wall. These are an estrogen sensitive benign tumor, and so they tend to grow in pregnancy too. So they can cause uterine pain during menstruation, and if you've never had an ultrasound or a sonohysterogram, you might not know that you have them. That's okay. We're going to talk about that. Endometriosis and adenomyosis are two other conditions that you might have. So endometriosis is when the endometrial lining inside your uterus, that's what comes out when you have your period. What people who have endometriosis, that lining is on other parts of the body, specifically in the pelvic area, but not limited to the pelvic area as well. So you could have endometrial lining growing on your ovary, in your fallopian tube, on your intestines, on the pelvic wall. And so when your hormones tell that endometrial lining to thicken in your luteal phase, that time between ovulation and your period, it thickens everywhere that those cells exist. So it's thickening in the pelvic cavity too, or wherever it is. And so when you're shedding your endometrial lining, it's bleeding in other parts of your body as well. And so that can be very painful. Although not everybody who has endometriosis has pain, and not everybody who has pain has endometriosis, it is a common symptom with this condition. Another condition that's sort of similar to endometriosis, this one doesn't get talked about enough, it's called adenomyosis. And this one is really common in people who are older than 35, for example, and who have had at least one baby, especially if you've had surgical procedures like a DNC, for example. So what happens with adenomyosis is the endometrial lining, which is supposed to grow on the inside wall of your uterus, is growing in the wall. So rather than growing on the wall, it's within the wall. So this makes a bigger, boggier uterus. So while everyone's uterus gets larger at menstruation, with people with adenomyosis have a bigger uterus all the time, and it's quite enlarged. And so when that bleeding happens, it can be very painful because it's inside the muscular wall, and that's not where it's supposed to be. Super common, so common that if you have had an ultrasound or a sonohysterogram and it was suspected that you have it, your doctor probably wouldn't even tell you, because it's sort of like, of course you have it, you're over 35 and you've had a baby. We'd be shocked if you didn't have it. That's how common it is. Other symptoms of adenomyosis include flooding, like lots and lots and lots of blood. And again, we're just convinced by society that this is just normal and part of being a biological female, especially when we get older. So what do we do about these things? I'm going to talk about that before I wrap up this video, but first I want to talk about some hormonal imbalances that can also contribute to period pain. We talked about fibroids and actually endometriosis and adenomyosis. They're all estrogen sensitive conditions. So hormonal imbalances can also, whether you're estrogen deficient or you have excess estrogen in your system, these imbalances can also cause period pain. And so what can we do about that? One thing that isn't talked about enough in reproductive health is the liver. The liver is not considered an organ of the reproductive system, but it's so critical of a player in our reproductive health, that I actually do consider the liver to be part of the reproductive system. Not that these systems are separate, all of our organs and body parts are always working together, but the liver is really, really important for estrogen balance. I could do a whole other video about that, and maybe one day I will, but we need a liver support for our the hormones to be balanced. Whether we're trying to conceive or not, or even if we're pregnant, liver health is really, really important. And I'm not even going to do that justice in this video, but there are things that you can be doing, like castor oil packs on your liver. I love dandelion root tea. Dandelion leaves are really good for your liver. So, and I can teach you one-on-one more ways to support your liver health. Another food that I wanted to talk about a little bit in this video is soy. Soy gets a really bad rap. There's a lot of information out there that says avoid soy because it is often genetically modified, but also a source of phytoestrogen. So there's a theory that it contributes to estrogen dominance, having too much estrogen. But I will say that my personal experience with soy is that it's very medicinal. I use organic soy. I use organic soy milk in smoothies, for example, and that's been like my number one go-to for period pain. So I didn't want to leave it out of this video. You'll have to try it for yourself. The months when I have had organic soy throughout the month, so most days a little bit of organic soy, I have painless periods. And so I really benefit from the plant-based estrogens. I think that they help block the xenoestrogens that come in from plastics and artificial scents and perfumes and things like that. So I'm gonna just leave that with you. You can do some more research and also just like try it with your body and see how your symptoms change with your next flow. So I also can't spend enough time on this in this little video, but gene mutations are also a really important thing to learn about. The MTHFR gene, the COMT gene, they affect the uterus and hormonal balance and estrogen balance. So do some research on those. Check out Dr. Ben Lynch or read his book, Dirty Genes, and it'll be like, you'll learn so much probably about yourself, because if you have period pain, you very likely will find yourself in the pages of his book. So if you have a reproductive health condition, if you have hormonal balance, we've talked about some of the things that you can do for yourself, but what I'm going to say is really you need the support. You'll benefit from the support of working with a holistic reproductive practitioner, because regular reflexology that is received every week or at a minimum every other week, so twice a month or 4 times a month is the best, is going to help your body to heal itself. It helps to put your body into a healing state. It helps to eliminate the stress, which contributes to hormonal imbalance. It helps promote a healing response in your body. We can give extra stimulation to points for the reproductive system and your endocrine system. I cannot say enough about reflexology and its ability to help our body to heal at the root of an issue, even without a diagnosis. So see a reflexologist, specifically one who has training in fertility and maternity reflexology specifically if possible, or by the Moon trained holistic reproductive practitioner. Holistic reproductive practitioners know more about the reproductive system, so we can help with those things like castor oil packs and abdominal massage for that position of your uterus, and helping you with liver support and all of those things. So you can do distance support if there's not one in your community. You can connect with me and I'll help you find a holistic reproductive practitioner to work with at a distance, or you can go and see one in person and get those reflexology sessions and all of that other holistic support, so that you can not have painful periods anymore, not have flooding anymore, or clots and all of those things, so that you can be healthy and balanced and hopefully keep your uterus for the duration of your life. And you can thrive and have better energy levels and less anemia and less need for iron supplementation and all of that. And if you are interested in learning more so that you can support other people in healing their painful periods or their menstrual irregularities or other health conditions not specific to the reproductive system, check out my website. It's bythemoon.ca, and I'd love to share this knowledge and expand on all of these things with you so that you can share information and educate people in your own community and support them in their healing.